So I'm Erin. I've been a nurse on the surgical digestive unit for the last 2 years. I got involved with safe patient handling with Ruth when I started the nurse residency program. And it's been great because I've been having a good mentor to teach me about all of the safe patient handling equipment. Well, for example, just in the past week, we do have a bariatric patient on our floor right now that is requiring a lot of dressing changes in areas that are hard to see. So we've been using like the leg lifts, leg straps to be able to visualize the area better, be able to document to what we're seeing, and being able to do dressing changes better. Also, we've had patients that are immobile, and just being able to get them up to the chair to, help their respiratory system, being able to get them up to a chair to eat a meal instead of sitting in bed all day. Also, just even using the chest vest to encourage ambulation and just give that patient a little bit more confidence in themselves. I feel like that has been a great asset on our floor, especially being able to use the equipment to get them to the bathroom instead of just getting them up to a commode. Just gives them a little bit more confidence in how they're doing at their stay. I especially have been seeing it as far as instead of boosting up on the bed, I've been seeing it used just to get patients up higher on the bed using the lift. It kind of went from let's just do a quick boost to let's just grab the equipment quick and we'll just get them up higher. And it's not even just about the lifts, it's just about, I feel like my coworkers are noticing themselves like tilting the bed differently and raising the bed and things that you didn't really think of before. I just feel like, especially with a lot of new people coming in and having the safe patient handling part of the orientation, people are getting a taste of it before even coming to the unit, and I feel like that has really helped. I also feel like there's a lot of, coworkers on the floor that are being role models for it that is really helping too. And it's very accessible. So it's, if we need to use it, it's right there. It's not like we have to go to another room to get something, which makes it a lot easier. We've also used it a lot because we get quite a few amputation patients on our floor. So being able to, get them up to the chair to, eat meals and things like that before therapy and stuff can get there and kind of help them, I think that makes a huge difference. Definitely. I've seen some patients that are a little hesitant just because when you're hooking them up, they want to grab onto the bar and they just don't feel safe. But once they're up in the air, they never have complained of, feeling in pain or anything like that. It's actually a lot more comfortable, especially if we're trying to boost in bed. That, especially skin issues, skin tearing, friction going up. Now we're able to just lift them up and get them in the right area. We can put pillows underneath instead of trying to turn them. We can just put them underneath and then set them down, and then they already have a good reposition. So I definitely think that skin issues that we have seen in the hospital have gotten a lot better just because of having the equipment. I definitely think that definitely would help. I mean, even this past week, I had a patient that her respiratory status was awful. Like I got there in the morning, and during the night, she was in bed, and she had a carotid to carotid bypass surgery done. So she was laying like this all night, and even we just got her all cleaned up, moved her to the chair, and just seeing how much better she did, like getting over to the chair. And if we didn't have that equipment right in the room, she probably honestly would have just stayed in bed just because it would have been hard to get her over to a chair. So definitely I feel like it has helped patients get better and discharge earlier.